You may get pregnant anytime soon. There is no supplement more important than a prenatal supplement, and it needs to be taken before you get pregnant. I'm Dr. Tod Cooperman of ConsumerLab, and we have tested and evaluated thousands of supplements since 1999. A key ingredient in prenatal supplements is folic acid, which helps prevent birth defects that affect the spinal cord and brain. Unlike many supplements, the evidence for this is very strong. Now, while folic acid is actually a synthetic form of folate, which is found in green leafy vegetables, in this case, it's better to get your folate as folic acid because it is absorbed 70% better than the folate in food. The reason why you need to take folic acid before you get pregnant is because the spinal cord forms within the first 26 to 28 days of pregnancy. So women who can become pregnant should be taking 400 to up to 800 micrograms per day of folic acid or another form of synthetic folate called methylfolate. Now, you can get too much folic acid, and our tests at ConsumerLab over the years have shown that some manufacturers actually put in much more than is listed. So you might want to stick to 400 to 600 micrograms per day. One tricky thing is that when you look at labels, folic acid is now labeled in terms of dietary folate equivalents, or DFEs, so that 400 micrograms of folic acid will typically be listed as about 667 micrograms DFE, or of dietary folate equivalents. Other nutrient requirements that go up with pregnancy are iodine, which increases to 220 micrograms instead of 150 micrograms per day, and iron, which increases to 27 milligrams per day instead of just 18. It's also recommended that you get about 200 to 400 milligrams of choline per day when you're pregnant. Now, many general multivitamins provide some of these nutrients, but typically not at the levels that you need during pregnancy and before pregnancy. ConsumerLab has tested many prenatal supplements, as well as multivitamins for women, men, and children. If you are one of more than 90,000 ConsumerLab members who support our research, you can go online right now and see our multivitamin review, which includes our current top pick for prenatal vitamins.